Good morning, Shubhanova Varsho guys. Today is Bengali New Year. I have a long working day today. So I have decided to take you on a trip to my hospital. I can't show you everything that goes inside, but give you a sneak peek of what's happening in the middle of the coronavirus pandemic. Things have changed drastically. It looks like a completely different place to work in now. But I can tell you something that a lot positive good work is going on. But don't take my word for it. See for yourself. Looking good is still allowed, especially now that my patients and colleagues will only be able to see my eyes. I do like to do a new good eye makeup for work. See you soon. So I've arrived at the hospital now. There are fewer people out in the common area, and this is because all non-essential, non-life-threatening work have been cancelled, so that staff can be freed up for more critical work. Our rota has also changed. We are working on an emergency on-call rota basis. So first I need to go to my ward to get changed. I'm changed into my scrubs now, as you can see. As I told you, we are only doing an emergency coronavirus rota, and we do wear our scrubs anyway when we are on call. But also with so much viral load going around everywhere, especially in hospitals, I do not wish to wear my own clothes when I'm at work. So even if I was asked to do a clinic or some other elective session, I would have changed into scrubs anyway. And I also keep my hair nicely tied up. Okay, let's just minimize infection as much as possible. I've got a mask to use in clinical areas, so you probably have figured out why I concentrate more on my eye makeup. One is always allowed to look good, and makeup is my feel-good factor. In fact, I'll say, especially at this emotionally challenging time, do things that make you happy. Even if it's just dressing up and taking selfies within the confines of your home or cooking up a lavish meal, do it. Anyway, so you might have had a glimpse of this one. This is a plastic sleeve that I used to put my mobile in when I'm at work. This is a new thing that many of us have started to protect our mobiles from getting contaminated. And this is one reason why I can't really show you footage of many different things, because the picture quality, the video quality through the plastic is not going to be brilliant. Also, the other reason, and that's a very important reason, is because of confidentiality reasons. I can't show you the face or anything identifiable, but I'm going to tell you what I've been doing, what I'll be doing throughout the day, so you can have an idea about things that we healthcare providers are experiencing during the time of coronavirus. Alright guys, I've finished my morning ward round, which is the time when we go around our wards to see our patients who are already admitted. I have got another call from a ward to see a couple of other emergency patients, so I'll make my way there. So this is something called a bleep. It's a pager basically. I know it's quite archaic, but this is how different people in the wards get in touch with us. So I'll be on my way. I was just thinking, in my footage I'll also include the work that the non-medical hospital key workers do, the cleaners, the porters. Just on my way up to the third floor, I saw a few of them cleaning the corridors, cleaning the common spaces, and moving very valuable things like PPE, personal protective equipment meant for us, from the storeroom to the wards. So they do deserve a massive mention here too. So the two patients I've been asked to see in the ward are both COVID positive, which means I have to don my personal protective equipment, and I don't bring my mobile phone near that area, which means that I cannot show you any footage or any picture of me donning and PPE. Okay, so both the patients I was asked to see are doing very well. They only had mild symptoms, and they are here because they recently had babies. This probably is a good time to tell you a few bits and bobs about pregnancy, delivery, and COVID-19. Based on all the evidence that we have at the moment, we think that most pregnant women who have COVID-19 either have no symptoms or very mild minimal symptoms. However, some can become severely ill. It's almost similar to what's happening in the general population, but to err on the side of caution, we are advising stringent social distancing and hygiene measures for pregnant women, especially those who have other medical conditions. Once babies are born, COVID positive mums can be with their babies. It is considered to be safe. They can even breastfeed. There is no evidence that mum having COVID-19 will have any detrimental effect on the baby. So far, we haven't noticed any increased rates of miscarriage or any developmental defect in the baby because mum has COVID-19 infection. There has been some increase in the number of babies born preterm, that is before completing 37 weeks of pregnancy. We think that it possibly is because we are medically causing a few women to deliver early just because they can be critically ill, and early delivery will help their own recovery. It's lunchtime now, guys, and I got my free lunch provided by the hospital. Ever since this COVID crisis started, all our food is being provided for free to staff. In addition, lots of private charities and donors are also bringing in pizzas, chocolates, many different things to show their appreciation. And I wanted to thank every one of you. We are so grateful for all the love that you guys keep on showering on us. I also have to admit that I'm incredibly fortunate to work in a very supportive hospital. There are enough personal protective equipments. We are being taken care of. There are resting facilities available. The hospital management is really doing a lot to make sure that we are comfortable and we are in the best possible physical and emotional shape to take care of you guys, to take care of those who need us. So after lunch, I had to review a few other patients, and then I had some emergency surgery to do. These patients are not COVID positive, but sometimes we also have to operate on people who test positive for COVID and who need operation for other causes. Of course, the kind of protective care that we use depends on the clinical scenario. For example, if I just have to go to a room and review someone who has COVID, I'll of course need protection, but that doesn't need to be as extensive as a situation where I have to go to intensive care to see a critically ill person with COVID. The reason why I'm talking about PPEs is because recently I've noticed a lot of misinformation and misunderstanding about them, because lots of videos from China have become viral where they have shown healthcare workers in full-on hazmat suits and gas masks. Now, we do not always need them. Do not be alarmed if you don't see healthcare workers in those white spacesuit kind of things, because there are other kinds of gowns and masks and shields available that offer the required amount of protection for us. Yes, but it's important that we do get enough PPEs, all healthcare workers, in fact, because this is a pandemic, which means anyone can have COVID. So for any clinical encounter, we should be adequately protected. In fact, one useful analogy is comparing a cricket field to a clinical situation. So in a cricket field, you have a batsman, a wicketkeeper, fielders, bowlers, and they don't all wear the same protective gear, do they? A batsman wears much more. This is because the batsman's chances of getting injured is much more than the other players. Similarly, also in a hospital setting, not all of us are at equal risk of getting infected. So we have to decide that how much protection is required where. And that is based on scientific evidence. It's not just my will or someone's whim. Does it make sense? If not, please feel free to ask me questions. Leave them in the comment box. I'll be happy to answer them. This is the floor where the ITU of our hospital is. In fact, we have got 2 ITUs, and we had them both before the COVID-19 crisis. They are both very well equipped. Capacity has been increased and there are a lot more critical care beds now, and staff from other parts of the hospital have now also joined. One of the questions that I get asked is if I come across COVID-19 patients. The answer is yes. My specialization is obstetrics and gynecology, that is the study of pregnancy, childbirth and diseases of women. However, in this current climate, in the situation where UK is now, where COVID-19 is everywhere, it is virtually impossible for any medical professional from any specialty to be in a COVID-free zone. Women with COVID-19 are also pregnant. They will also deliver. They will need care when they have got complications with cysts in their ovaries or conditions of their womb. Some of them may become very acutely ill, and we have to still look after them. Thankfully, most people with COVID-19 will not need a trip to these ITUs. Most will recover at home, and that's the current guideline in United Kingdom, by the way. Those with mild to moderate symptoms, they don't even need to get tested. You have to self-isolate at your home for 7 days to start with. But these recommendations are not universal. Each country has its own recommendation based on their local healthcare facilities, the stage of the pandemic they are in. So please check with your local health authority for more information. But as far as the United Kingdom is concerned, I can tell you that nhs.net has got plenty of information on coronavirus, and the recommendation is if you have a fever or cough, you self-isolate at home for 7 days. If the fever carries on, then you self-isolate for 7 more days. Other family members have to self-isolate for a total of 14 days, starting from the first day of you having your symptom. If you become unwell, if you need medical advice or help, call 111. If, however, you become acutely unwell, then the emergency number to call ambulance is 999. And if ambulance paramedics think that anyone needs to be hospitalized, then most probably they'll end up in one of these ITUs. The reason why I have had to come upstairs is because some of our patients are here too. I'm not going to tell you any more details about them. You have seen plenty of pictures and read plenty of articles, but there is another aspect, and I think people should know about it. Coming here is such a humbling experience. You see the immense resolve and resilience of your colleagues, the doctors, the nurses, the healthcare assistants, the cleaners, the physiotherapists. Every single person is doing their job with so much determination, with smiles on the faces. It might seem like a very weird thing, and believe me, I'm not a sadist when I say this. This is a very scary time to be a doctor. You are scared to come to work, you are scared to go home and potentially spread virus to your family, but it's also a very exciting time. It's such a challenging time, and these sorts of challenges can really bring out the best in people. When I come to the hospital, I don't have any fear, and I'm not the only one. Once inside the main entrance, I see nerves of steel, I see determination, I see smiles, I see helping each other out, looking after each other, being supportive, empathy, sympathy. It just feels amazing to be a part of this community. And the one sentence that I keep hearing every now and then, it keeps on flying in the medical world, is this is why we became doctors. I have to tell you the truth. This is not why I became a doctor. I never wanted to be a doctor. My parents who had this ambition for me, and like any good, obedient, desi girl, I spent sleepless nights with my biology books. But I'm so glad I did. There's nothing else that I'd much rather do now, no matter what the risks are. And it's not because of the claps or the candles or the thank yous, the free sourdough breads that keep coming our way. It's not because of any of those. I have enjoyed being a doctor for, I'll say, all of my career, but this one just tops the list. Don't get me wrong, I still wish that it had never happened, and I feel extremely sad at what the world has come to. But if I had to live a life in the middle of a global pandemic, I wouldn't want to be anything else other than a doctor, and I wouldn't want to work for anyone else than the National Health Service. NHS is honestly one of the best things on earth, and I'm not exaggerating. It is a place which treats the Prime Minister of the country as well as the poorest of the poor with equal care. I can't imagine that happening in most parts of the world, and I hope and pray that one day all countries will have their own versions of NHS. I really hope they do. And I also hope that people who live in United Kingdom, they realize how fortunate they are for NHS. I think I'm getting a bit sentimental here. I should get back to work. I still have got, I think, 2 or 3 more hours of shift. I don't know what time it is because we are not allowed to wear watches at work. We never were. NHS infection control policy was always bare below elbows. So enough of sentimental talk. Let me go back to my floor and see what else needs to be done. That brings us to the end of my shift today, done with about 12.5 hours. And I have to make sure that whatever I carry back home doesn't carry any virus. So there's a lot of cleaning involved now. I'm also going to take a shower and shampoo my hair because I've been to quite a few COVID areas. Sometimes things can be physically and emotionally challenging. I think more than us, healthcare workers, it's our families who really need the support and the appreciation. We chose to do this. This is our life. But they did not choose to live this life of constant anxiety and uncertainty. I told you, my parents wanted me to become a doctor, and they in fact wanted me to come and work for the NHS. But now that I am doing it, they are worried for me, which is understandable. My husband has been very, very strong and very supportive though. So yeah, I'm lucky that way. I'm lucky that in spite of everything, no matter how much distant I still have to be with him and how much sacrifices he has to make, I still have someone to go home and talk to and rant and vent if needed. I think it makes a massive difference. So this is our care basket, just to let you know. It has got shampoo and hair dryer and bits and bobs to remove makeup and cream. We don't have makeup here yet.
Yeah, that's the next step.
But we also have lots of food down here if you ever need. Yeah, we'll look after each other. So that's the end of my shift today. I'm now all showered, shampooed, ready for my husband, who has come to pick me up. It's Bengali New Year's Day today and we will be celebrating in our own little way. He has picked up takeaway from a Michelin star restaurant in London. I mean, it's a bit funny and amusing how luxury restaurants have now started takeaway services. Anyway, good for us. We are going to have Indian food tonight. So have a very happy new year, very happy day, very happy week, month, lifetime. Remember, this too shall pass, and I hope that I could show a not so depressing and not so scary face of coronavirus crisis. I'm not trying to underplay the severity of the situation. It is devastating. It's going to have effect for a long time to come. But let's all look after each other, take care of each other, and we will go through this together. We are in this together. Just remember it. And dogs do not spread coronavirus, guys. They only spread love. The food is really nice. It's from Benares, by the way, in case you're wondering. We have had a proper dinner there before when times were different. But anyway, overall the day was nice. It had its lows, but thankfully I have a lot in my life to make up for it. Is there anything you want to share before we finish the video?
Not much, but all I want to say is that I feel really privileged that I am part of the extended NHS family.
You are.
And all of you guys are doing a fantastic, a fabulous job.
Thank you.
And it just fills me up. My heart fills up so much when I see the whole community coming together to show its appreciation, to show its gratitude for all the frontline workers, the nurses, the doctors, everyone.
That's true. And it's not just the appreciation, the way the community has come together to rally behind us, to watch our backs. It means a lot. It makes a massive difference, guys. And I think it's not just limited to United Kingdom. Let's be fair. I think healthcare workers across the globe are privileged to get a lot of support from the communities around them, and we are ever so thankful. And as I said before, when leaving the hospital, we are in this together and we will see this through. Bye.